Well, hello there, very good evening, and thank you for joining us on this edition of the People's Parliament. We are in the jurisdiction of Lira, and my name is Romeo Busiku. I couldn't be more excited to be in your midst. Well, we are here to talk about the water, sanitation and hygiene sector in this jurisdiction of Lira District. Remember, Uganda and its water, sanitation and hygiene sector is actually considered one of the most developed in sub-Saharan Africa. We are not the best, but we are considered one of the best. Well, we do have some persisting challenges. Well, the growth of the sector has stagnated at 3% in the last 10 years since 2013. And in that regard, 20 million Ugandans are still stuck without access to a safe drinking water source. All over the globe, that number actually skyrockets to over 775 million people without access to a safe drinking water source. Back here in Uganda, 65% of our population is not practicing proper hygiene behavior. That's what we found out courtesy of WaterAid Uganda. What else do we know in that regard? We also do know that 8% of the total population is still practicing open defecation. When one has to answer the call of nature, they run to a bush nearby, or they use a cavera and they throw it into a water source or a water body nearby, leading to waterborne diseases in that regard. So it's a really debilitating situation. We also do know that 16% of the female-headed households here in Uganda are actually using the bush as toilets. That number goes down to 10% for the male counterparts within Uganda here. Looking at Lira District, according to the Ministry of Health, Lira District has some 35 healthcare facilities within this jurisdiction. Out of that number, 14% of the healthcare facilities do not have access to a safe drinking water source. That is terrible. In Mbale, yesterday, when we were in Mbale, we did reveal that 14% of the health centers within that area do not have access to a safe drinking water source. In Lira, that goes up to 14.3% of the healthcare facilities not having access to a safe drinking water source. And 11.4% of those healthcare facilities have limited access to a safe drinking water source, and over 68.6% of the healthcare facilities within Lira District actually have some basic access to a safe drinking water source. Let's now invite the chairman of Lira District Local Government, that is none other than Mr. Okello Orik. He's already here in our midst.
Thank you so much, the Speaker of the People's Parliament. Indeed, we are so grateful that with the little resources we have been trying our level best to ensure that we provide the worst services in our health centers. We have two constituencies now, that's the Route North and the Route South, with one health center for each. A good health center for representing the one for Route North. Then we have a March health center for sub-district, which is for the South. And we have other health center theories in most of our sub-counties and health center tools. What I can say about wash issue, especially in the South, is fair compared to the Route North, because a March itself has got tap water, because in Lira City and Lira District is served with water coming from Kachung, and the water branches and goes to a March sub-county, where there is a March health center for. And we don't have much problem there because of the tap water system which is already established. And if you look at the statistics there, it is fair as compared to Route North. Route North has health center 4, which is, I said, it's so good, but has no pipe water. They are relying on water catchment, which is sometimes come from the roof when it rains. They're also using boreholes, which helps in providing facilities to help in that health center. Then other health center theories are depending on boreholes, which are not very reliable. And some of these boreholes, which are not reliable, are being shared by the communities around, shared by the health center. And then it's even worse in Aramo because the sub-county headquarters is near the what? Is near the health center 3. And yet even a big trading center is established near the health center 3. So it is a big challenge because that same water source is the one that provides the water for the health center. So it makes it very difficult for the health facility to receive adequate supply. Because if you're talking about wash, water is key. Water is key. If you look at the facilities of toilets, we are only lucky that we have partners who have been helping us to give us those toilets, who have built for us these toilets, which sometimes are not adequate. So the district itself, because of the carving of the city, which has taken away most of the peri-urban areas, our revenue, local revenue source has reduced drastically. We used to have good revenue collection, but because of the carving out of the city, which has taken away 4 sub-counties from Lira District. In other cities, when they were creating cities, they took only parishes and to annex to the city. But Lira District gave 4 big, lucrative sub-counties to the city. That makes the collection of taxes, local revenue, is so minimal. What we are getting now is almost a quarter of what we used to collect as a district because of carving out of the city. And therefore, it has made it very difficult for us to provide adequate services to our people. And I hope my people will understand this dynamism that has been created because of urbanization, creating of the city within the community that we live in.
I see.
To make it worse, Honorable Speaker, we will not even mind so much about the local revenue we are receiving to serve our people. Have a very big concern with the government.
Which is?
The government has not been very supportive. The money they're releasing to us is so reduced. To make it even worse, the little taxes we are collecting from the local communities, these rural communities, are first of all taken away to the center, to consolidated account, which is in Kampala. And you wait for them, you beg your own money to be released back to you.
I see.
Honorable Speaker, this is unfair. This money which is supposed to be collected is supposed to enhance services to the people who have given those taxes. But you cannot give them the services because of the systems which are being run.
Indeed.
All the money is first of all taken to consolidated fund, and access that money is a big problem. And I also want to make this one very clear today, that Lira District had many camps, IDP camps, which had water points put in by NGOs to support the people who are in the camps. But these water sources are all being destroyed now. They are not functioning. But when you look at our statistics, they will tell you that we have enough water. The water sources are there. I give an example of Baloyo. There were 19 boreholes in Baloyo alone. But out of the 19 boreholes in Baloyo, only 1 is functioning. Only 1 is functioning. But if you look at the statistics, it was not decommissioned. These boreholes were not decommissioned, and it still shows that we have 19 boreholes. Yet it's only 1 functioning. Yes.
Ladies and gentlemen, give it up for Chairman Oriko Kello, the leader for Lira District Local Government. He was acquainting us with the information surrounding the status of the water, sanitation and hygiene sector right here in Lira District Local Government. Well, and we are going to kick off with the Chief Administrative, that is the Assistant Chief Administrative Officer for Lira District. There is none other than Mr. Okello Ponswater to tell us the status of the water, sanitation and hygiene sector here in Lira District.
Thank you so much, Mr. Speaker. The question posed to me by the Speaker in terms of the status of wash in Lira District, given by his statistics, I can basically say that as Lira District, we have not been doing so badly in terms of wash, and specifically in terms of budget allocation, because one, we have been, the areas of our focus in terms of the budget has been in terms of, first of all, we have been advocating for more budget, more funding on this area. We have also been doing a recruitment of the critical cadres to support wash activities, but also we have been doing a lot of monitoring and support supervision.
I see.
Alongside having the health unit management committees and water user committees who are on the grassroots to ensure that the activities of WASH are carried out properly. As we talk right now, 25% of our budget under health is for health promotion. And this has gone a long way to improving the status of our WASH facilities within the district.
Thank you so much. That is Mr. Okello Ponswater, the Assistant Chief Administrative Officer for Lira District Local Government. At this opportune moment, allow me invite, that is the Country Director for Water Aid Uganda, Ms. Jane Sembuche. She's going to talk to us about what the civil society organizations like Water Aid Uganda have been doing to advance and uplift the service levels of WASH in various healthcare facilities, national, sub-national, and of course community levels.
Thank you very much, Speaker. Water Aid is an international organization whose vision is seeing everyone everywhere accessing safe and clean water, sanitation facilities, and practicing good hygiene. We believe that is central to the development of our countries. It is central to human health. It is central to our communities and our people really becoming developed. As Water Aid, one of the aspects that really drives us is to be able to see WASH, that is water, sanitation and hygiene prioritization, sitting centrally in many facets of our development. We want it to be seen as multi-sectoral, which it is. It cuts across in education, it cuts across in financing, it cuts across in so many spheres of what Uganda is aspiring to be in 2040. Now, as Water Aid here in Lira, what has brought us here is to be able to see an improvement within the WASH services, particularly in healthcare facilities. Healthcare facilities is a place that gives people back health, is a place that brings in life when women are delivering, is a place that we need to safeguard when it comes to cleanliness and provision of services. Now, the challenge is that we have, not only in Uganda, but Uganda is one of the countries that the service levels are not where they should be. The statistics that you talked about, where you have facilities with no water services, and you can imagine if you have a facility with no water services, how are the nurses, how are the midwives, how are the doctors going to be able to provide these services? So that means that even our community members may not go to the facilities and will continue in a vicious cycle of not being able to provide the care and people not coming to seek the care because our facilities cannot be able to deliver that. Now, we are in Lira to be able to work with the district in being able to prioritize planning in addressing these challenges and blockages for access to not only water but sanitation. How do we overcome the blockages that are here to enable us after 5 years, if we are at 14% or 11% in terms of facilities not having access, how do we get to 0%, but at the same time, how do we get to advanced service levels for not only water coverage, but sanitation coverage? What does this mean for us? It means us picking out the blockages. If the blockages are in financing, where are those blockages? Women suffer a lot, girls suffer a lot when WASH services are not available to them. It is the women that bear the burden of healthcare, taking children to healthcare facilities, providing them with support at home. It is the women that also are compromised when they need to go out and be able to generate income for their families. So this is what is really pushing us. How do we stabilize our country, our economic development, but by ensuring that the health of our people is taken care of? And this is one of the way, and it's the backbone. And this is preventive medicine that we need to see more prioritized rather than curative medicine that we're seeing is taking center stage. I also feel that we need to prioritize behavior change campaigns. It's communities that are going to turn around behavior change. It's communities that are going to realize how to prioritize sanitation facilities that are appropriate for use, and we need to leverage that strength within communities by behavior change campaigns that are nationwide, that are focused, so that we can be able to inspire the people of Uganda. But not only that, it goes back to leadership, it goes back to planning, it goes back to making sure that we are not just talking, but we're identifying those avenues that can allow us to get the resources, not only financial, but the human capital and the other aspects of resources. It's about bringing partners in to be able to support not just NGOs that are going to be here for 10 years and then go, but private sector, community groups. These are all strengths that we can leverage to be able to target the achievements that we want to see in the wash sector.
Ladies and gentlemen, give it up for Ms. Jensen Buche, Country Director, Water Aid Uganda. They've done a lot to advance and improve the water, sanitation and hygiene sectors in various jurisdictions within the country. We were in Mbale, and many of the people commended the good work Water Aid has been doing in their jurisdiction. And in that regard, let's talk to the District Health Officer for this jurisdiction, Lira District, that is Mr. Okello Innocent.
Thank you very much, People's Parliament, for this evening. Good evening, everybody.
Good evening.
I want to present on behalf of the DHO on the issues of WASH. First of all, I want to say that WASH is a key area which is targeted to prevent infection between the patients and their caretakers, the health staff, and then those who are vulnerable, who are our mothers, who are the disabled, and the community at large. Because a health facility, when we go to, should be a place where we are going to treat what we have gone with, but not to pick what we have, again, gotten from there.
Nosocomial infections.
Nosocomial infections. Those infections that you get, which, in addition to what you have already had from home. So we believe that with WASH well facilitated, we would be able to prevent most of these diseases in our communities, and only treat those which we have gone to for care at the health facility.
Indeed. Yeah. All right, thank you so much. That is Mr. Okello Ponswater, the Assistant Chief Administrative Officer for Lira District Local Government. So let's talk to the Northern Umbrella for WASH, Water and Sanitation.
Thank you very much, Speaker. And good evening, everybody. I am called Oluwabone Brown. I work for Northern Umbrella of Water and Sanitation, which is not necessarily private sector as such, but an agency or a unit under Ministry of Water and Environment.
Oh, really nice.
And we are in charge of operations and maintenance of pipe water systems and also sanitation facilities in the greater northern Uganda. We work in Lango, Acholi, and West Nile. To address myself to Lira District specifically, so in the rural north, we have a health facility which is under Ogur sub-county. That is Ogur Health Center 4, which is a district hospital. In this area, we have been having a challenge because the water facility that was initially constructed there during the time of the IDP has actually collapsed.
Wow.
So as a ministry and the Northern Umbrella of Water and Sanitation, we have been coordinating with the district to see how that particular town can actually also benefit from a piped water system. A neighboring town to that is Agweng, which is already having a facility which is up and running. Then another one is also Aromo. Aromo is also another sub-county, but almost peri-urban.
Indeed. As a wrap-up.
And the challenge, of course, has been that government intervention in maybe constructing these facilities is largely funded by the donor funds.
Wow.
And all about 25% from government of Uganda. And therefore, at the moment, the reason why Ogur has not yet benefited from a new facility is because we are in the process of writing proposals to our development partners to ensure that we come up with a bigger project which is able to support not only the health center, but a bigger community.
So you're also incapacitated by funding?
Obviously.
Indeed. Thank you so much. That is Mr. Olwa Bonnie Brown representing The Northern Umbrella for Water and Sanitation. Let's take a very short break. Return with more information from the members within our midst here on the People's Parliament. We'll be right back. Welcome back and many thanks for staying with us right here on the People's Parliament Lira edition. My name is Romeo Busiku and I'm your speaker for this August House. We are going to hear from Mr. Olet Geoffrey. He is a representative for the Health Unit Management Committee. He's going to give us the status quo of the various water, sanitation and hygiene sectors within Lira District. Sir, welcome to the People's Parliament.
Thank you. The Speaker, ladies and gentlemen of the People's Parliament, my name is Godfrey M. Uletapar, the Chairperson, Health Unit Management Committee of Bar L Center 3.
Godfrey.
Dear members, Bar L Center 3 is located within Bar Trading Center, and in the same place, we also have Bar Sub-County Headquarters. Within this facility, we have only one borehole, which was even constructed during the time for the IDP. And this one borehole is being used by everybody around, thus making it not very good for very fitting for the health facilities. Now, within the health facility, we also don't even have another source of water to help now the patients from inside. In the same way, when you come to the sanitation and the hygiene Barrel Center, I know if I'd known that I was coming to talk about this, I was not coming. I would feel shy, because when you move there, you may think that this is not the health center. I'm not accusing anybody, by the way. I'm only talking about the status of the health center. One time, I have the fear that even all the toilets may collapse. The toilets for the staff, they are in dilapidated conditions. The wallings are very poor, and they're about to collapse. Others have already collapsed, thus making the lives of the health workers standing at very high risk. And when you come to the one which is there within the health center, within the health center itself, which is used by the patients, we have only 3. But these 3, they are a little bit okay. Now, that is as per that concerning the status of the wash.
Thank you so much, sir, for coming through. We have leaders here who are going to redress your problem. Indeed. All right. We also have a member of Parliament on that is the Forum for WASH. That is Mr. Isaac Etuko, Upper Madi County. He's going to talk to us about what the members of Parliament, the August House of the country, are doing to improve the water, sanitation and hygiene sector of the entire country, and not only Lira District.
Their honorable members. Right Honorable Speaker, you'll realize that when we look at issues of WASH, it's one of the critical matters which in fact everybody must be concerned about.
Yes, all right.
And that is why the members of Parliament came up with the Parliamentary Forum on WASH to see how we can influence policies and activities affecting water, because water, sanitation and hygiene are issues which really affect the lives of our people. But unfortunately, over the years, when you look at the budget for water, you realize that it is one of the sectors which receives very, very little budget. For example, when you look at the budget of 2022 and 2023, WASH, the entire WASH was only allocated about 8 billion shillings, and that represents only 3.3% of the entire budget. And in the budget proposal already for 2023-2024. WASH still has very small allocation of about 8.6 billion, which is a very slight increment from the previous years.
So we might end up with the same status quo with inadequate access to...
Exactly. This is one of the reasons why we, the members of parliament, came up with a forum that must talk, that must advocate for water.
Even with the existence of the forum, we still have only an increment of 8.6 billion. The last one was 8 billion.
Exactly. And you even see that small increment there was a result of the push. I want to end by saying that WASH is everyone's concern, and we must do everything possible to see that we address it. I thank WaterAid. I thank all the organizations working with water, and I think I'm very proud to join them. I'll have interactions with them after this. Thank you very much.
Upper Madi County MP, that is Mr. Isaac Jokino Etuko. Thank you so much for your submission. Let's also talk to the district the district water officer. We'd like to talk to the district water officer for Lira District, Mr. Hudson Omoko.
For us as a water sector, we are charged with ensuring that everybody access water, including health facilities. Now, part of our service to the community is by ensuring that health facilities have access to water. Because when the health facilities have access, it means other communities also do access. So we are trying to ensure that we prioritize our budget allocation to those areas that are easily accessible by the community, like the health centers. So that becomes our biggest priority. Then, in terms of ensuring that the system continues to function, because we have noted scenarios where we put in the facility, but then also the facility doesn't function. So we try our best to ensure that there are mechanisms to ensure that these facilities continue to function within the health centers.
Thank you so much, Mr. Hudson Omoko, District Water Office.
Thank you very much.
Indeed, thank you. All right, we have a community opinion leader within our midst. Welcome.
As far as WASH program or WASH in the community, the experience we have seen is that the community themselves, they are also lacking certain things. Like you will find out that some community, even within they are lacking central facility, like the latrine, they are not there. Others will have, in fact, it is purely poorly maintained. They may be lacking the latrine cover, which is not there. No unwashing facilities. And if they are there, you will find sometimes the soap or ash, which are supposed to be used for cleaning the hands. They are not there. And sometimes, actually, when the washing facility is there, you may be surprised to find that there's no water. Maybe in the tippy tap. So they put that thing, sometimes then they forget. Or else sometimes the tippy tap is even destroyed by animals. Like these days now, when the animals are just moving anyhow. So they destroy all those things. So when they destroy, it takes time again to put it right. Unless they are empowered to at least to maintain it so that they keep it regularly.
Thank you so much, sir. We have a representative of the private sector, Right Honorable R.J. Ojao, that is a Lango Cultural Foundation.
I would like to approach it from the community side.
Please do, please do.
I'm very happy, first of all, that you have brought this issue here. And I'd like to mention what you specialize first. I think it's important that we understand it, then we follow it comfortably.
Please do.
You specialize in water for sanitation and hygiene, which is very good.
Oh, yeah.
You also have a vision, which is equally very good, that you want everyone, everywhere, to have access to safe water, sanitation, and good hygiene.
That's our prayer.
But these things are only going to happen when there is water. So that means, therefore, we need to have the water first before we move to those other WASH issues.
Indeed.
So I'm thinking, first of all, let's have the water in places. Now, the places that we already have the water are the boreholes, can we have the wash facilities at the boreholes?
Indeed.
We also have water at health centers, obviously. Some are run taps, some are boreholes. Let's have wash facilities there. We also have functions, religious sect functions, events. Before those functions really take place, can we have waters in those places so that we effectively wash?
Yes, indeed. We shall call on you again for some recommendations on how best to alleviate the situation at hand. We have a health assistant within our midst we intend to talk to, but that is going to be shortly after this break. You're still watching the People's Parliament Lira edition. My name is Romeo Busiku and I'm your humble speaker. We'll be right back. Welcome back. Glad you're still watching the People's Parliament Lira edition. My name is Romeo Busiku. And of course, we are here to assess the water, sanitation and hygiene sector within Lira District that has some 35 health facilities, of which 14% have no access to water, 11.4% have limited access to water, and 68.6% have basic access to water. Nearly 85.7% have limited access to sanitation. I do have Birunji Anet, a health assistant. The subject at hand, we are talking about the water, sanitation and hygiene sector in Lira District.
I'm going to actually subdivide this into 4 key indicators. One of it, we are looking at acceptability of the facilities which are installed. We look at sustainability, we look at functionality, and then lastly, ownership of the facility.
Under 5 minutes.
Looking at all these 4 indicators, we have actually subdivided them into different categories. We are looking at water as one of the key indicators, whereby during sensitization, we focus at improvement of hygiene and sanitation at 70% before the installation of the facility. This is done during advocacy meeting with the users at the facility level. We look at memorandum of understanding. Since the facility is going to be installed within the facility, what is your input as a facility in terms of operation and maintenance plan for the next 1 year? How will the facility be maintained? We focus at leadership and governance, that is training of water source committee that are actually supposed to be instituted to manage the facility which have been installed. And then we look at land agreement during sensitization. This is a case in point whereby some of the facilities have actually given out the land, but in turn, when we look at other perspective, there's issues of land wrangle. So one of the indicator the facility has to sign to clearly indicate that this land where the facility, water facility is going to be drilled is purely managed by the health center.
I see.
Looking at the second phase, that is the construction phase, we engage the leadership at the facility level to embrace and to ensure that they support during the process of drilling and installation, giving support. This is a clear sign and indication of management and sense of ownership. Looking at capacity building, when the facility is already installed in place, we are looking at how best are the leaders going to take up the mantle towards management of the facility. Lastly, the third phase, which is the post-construction phase, where so much the health assistant and then health inspectors are so much engaged, we ensure that the quality of water which has been actually put in place, there is the routine monitoring, inspection, water quality surveillance and testing which are actually put in place, and then routine operation and maintenance rolled down to the users. We want to actually basically look at sanitation within the facility where we cannot segregate it all at this time because of time. Looking at the design, is it acceptable by the facility, the clients? Are they in position to use the facility? In most cases, once sanitary facilities have actually been put, you realize that even the squat hole covers, the squat hole, it is not actually to the best design that a client can easily access and then use. Then we look at the disadvantage, the vulnerable. Are they in position to use this latrine facility within the health center? And then we look at gender sensitivity during our sensitization, looking at patient stance ratio. Is it adequate enough? I remember one of the health unit management committee talked about dilapidated facility. Actually, that is my health center. It is alarming that sometimes the health center staff may not have access to actually go and ease themselves. Because of the design, it has taken long, it can't actually be repaired. So it becomes so inconveniencing for both clients and then the staff using the facility.
Thank you so much, Birungi. Annette, you cannot advocate for these things if there is no water to begin with. Thank you so much, Birungi Annette, a health assistant in that regard. With a show of hands, I'm going to pick randomly, all right?
My experience about WASH is contaminated water affects the reproductive health of young girls, whereby in the near future, they will cause infertility. In that, in different schools and in homes, that latrines are always dirty, and when there is no water to wash, they will always have these infections. Another one is in health facilities, whereby when there is no enough water to wash the facilities like different wards, we can easily get these infections from these wards. Thank you so much.
And indeed, thank you so much. Inadequate WASH services can put the lives of the doctors and the patients alike at risk. Thank you so much. Apok Irene is our last one.
We are saying that poor health hygiene among girls and women, whether in the community or facilities, bring a lot of health risks. And these health risks can be reproductive or even urinary tract infections.
Indeed.
And with this health risk, we are seeing that girls and our women in future, they are at risk of being infertile. Being infertile or even developing pregnancy complications, birth complications. So I think this is a very important issue and we need to address it to avoid these challenges in future.
Let's talk to a head teacher. He's going to give us a brief account of the experiences he's had to go through as a result of, manning that educational institution.
The primary schools is one of the public places with a lot of need of water.
I see.
Like in my school, I'm the head teacher, and having one ball, and yet it should serve 1,600 pupils. Including
one
staff.
For 1,600 learners?
1,600 pupils, and then teachers, 20 teachers, including visitors who go there. So it is really not good when they are starving just to drink water. Leave alone.
Borehole. I've had instances of 8-year-olds undergoing menstrual cycles. So by primary 7, we are talking about 13, 14 years. And I'm sure you do have some girls who undergo menstrual cycles. So with one borehole, how are they going to survive in this?
Exactly. So I give my opinion that there was facilities should not only be in health centers, because water is a universal solvent. It cleans everything. Along with there are solutes which can be germs. So we are highly in need of water in primary school, among other public places.
Thank you so much. He was very spot on and brief with the subject. That is Mr. Ayo Joseph, a head teacher. He has one borehole for 1,600 of his learners and also 20 teachers. A very debilitating situation that has befallen his education institution. Like I did say, if I had the money, I'd give it to you. Because in just 1 hour, I really feel the problems that you are going through. But what I do not understand is why the government has actually been silent to this issue, or they are dilly-dallying when it comes to increasing funding to improve and advance WASH services within Uganda, and not only Lira District in that regard. Well, we've heard it from the head teacher, and then we do have Mr. Okud Gino. He is the health center in charge for Agali Health Center 3. Yes, there he is.
Thank you, Mr. Speaker, and good evening, members of Parliament.
Indeed.
I'm Gino Kot, the in charge of Agali. My experience in Lira District, I've served in almost all these health centers. Almost 80% of the health centers, I've served in them, including Ogur Health Center 4.
What did you discover? What did you discover?
Okay, what I discovered, I've discovered that water is a priority in health centers. And without water, you can't operate. And when you want to experience this, that water is a priority, let there be a breakdown in borehole or water pump. That will be the end of the health work that day.
Wow.
Because even those health workers who like absconding, they will also abscond, claiming there is no water. And then other departments like lab will not function. So
I'm wondering, that woman who has to undergo a C-section and then there is no water.
Obviously, you can't operate.
No water. Isn't that death,
you can't work.
mortality rate going up?
You can't work when there is no water. You have to refer that patient.
Wow. Like I did mention, we are here in the jurisdiction of Lira District. We've mentioned so many of the challenges that have befallen this jurisdiction, but what about we get into the solutions, the recommendations that are actually coming in from the members of the public, opinion leaders, politicians that are already here, and members of civil society, actually Water Aid Uganda. Yes. Miss, who wants to go first? Let's go with Mr. John O'Court, and you finish your submission, sir.
Well, I was talking about recommendation now. Welfare
of your people.
Welfare of
and you had a few additions.
The community and the health workers, because we cannot talk about community when our welfare is not good. I've talked about the housing. Then I have talked about installation of this solar-powered water. And this water should be piped to reach our place of work. Like in fact, all these health centers, I've told you, I've served almost into 80% of these health facilities. We still use this water which is put in the bucket and you provide a tap, which is uncalled for. So we appeal to the government to provide pipe waters to the OPDs, to maternity. It should be piped so that at least it's real accessible to everybody to use that water.
Well, thank you so much, Mr. Okojino, for that.
Thank you.
All right. We also do have Honorable Jokeno Etuko Isaac. He is a member of Parliament representing Upper Madi constituency. He had so many recommendations, and I touted that before, but then this is the opportune moment, sir.
Thank you, Right Honorable Speaker.
Indeed.
I have the following recommendations to make to improve on water, hygiene, and sanitation. I want to start by looking at the economic empowerment of the people. In fact, every government program should look at the economic status of the people, because when we talk about clean water, hygiene, and what have you.
In 2 minutes.
Economy has a lot to do. To say those who are very poor are far-fetched from issues of water. You cannot talk about clean water for a very poor person who cannot even afford to build a good toilet. In this country, 8 out of 10 people don't have clean toilet. And that is a reality. And you'll also find that 2,696 children die annually. And in fact, we are talking about 33 children dying daily because of diarrhea. And all this goes back to the very poor people who cannot have access to water, hygiene and sanitation, and it's one big problem. Then the second recommendation I want to make is to call upon everyone to advocate for budget increase for wash activities at national level, at local government level, and at institutional level. Like when we take UPE and the USE, we have percentage for co-curricular, we have percentage for senior women teacher and other things. But I would also advocate that let there be percentage for wash activities in that kind of thing, so that we can see how it can be done. Then thirdly, finally, we need to have community empowerment on water harvesting and maintenance of existing water facilities. That one I had already talked about it. But then I would also say that we need interministerial incorporation of water, sanitation, and hygiene issues in all the projects that are implemented in the institutions. But most importantly also, I want us to advocate for equal opportunities or regional balance in distributing water projects in this country. Because you find that in this very country, there are regions or there are areas where people are now advocating for water for animals, clean water for animals, when in some places they are people are still toiling
Indeed.
with water for no people. And lastly, I would request that the government at national and local government levels should develop or think about better housing units that can enable people to harvest water. Because when you look at the entire north, almost 80% of the houses are just grass-thatched houses where people cannot harvest water. And yet we have a lot of rainwater in some seasons. So I would in fact think that as government now looks at institutional constructions, they should also begin to look for money to provide iron sheets, as it has started in some parts of this country. We saw iron sheets being distributed in Karamoja and other parts of the country, so that people, the poor people, can, even if you have 4 or 5 iron sheets, you can harvest water, particularly during rain season. I thank you, Right Honorable Speaker.
Very solid recommendations coming in from Honorable Isaac Etuko Jokino, MP for Upper Madi constituency.
Thank you, Right Honorable
So
Speaker.
please suggest for us ways that the private sector, the Lango Cultural Foundation, members of the community can work together with the city or Lira District to ensure that we advance wash facilities and services.
For facilities like that, we need to settle people in communities. Let's put people together and sink a borehole for them. Let's put people together, probably extend electricity to them. So people should be set in communities. 2, those communities which can collect water during rainy season, give them tanks, which water can be used during dry season. So that you collect these tanks, this water, 3,000-liter tanks, so that they can use this water during dry season. This, I think, is possible, and it can be done.
Indeed.
So basically, it's community connections to supply people during dry seasons. And then, of course, the water itself. If you can drill boreholes, then also create around the boreholes washing. But I have been listening very carefully. I have not heard anybody talk about soap.
Please do.
They did.
Please
Maybe I
do.
missed it.
Please do. Talk about it.
So can we also provide soap? You just don't wash with water. You wash at least with soap so that the dirt is fully removed. So I think let's also consider liquid soap.
Indeed. Right Honorable Ajal James, is the Prime Minister for the Lango Cultural Foundation. Thank you so much for that humble submission. And indeed, a lot has come through with regards to the subject at hand. If we do not advance and improve wash services in the country, like Jokino did say, 33 children are lost every day due to diarrhea. Simple diarrhea, 33, and over 2,000 in a year. That's according to Jokino. So indeed, we need to do more. So let's talk to Ms. Jane Sembuche, Country Director, Water Aid Uganda, and come up with some of the issues that they've put in place to improve the status of WASH in healthcare facilities at all levels, and what the outlook of the advocacy agenda for Water Aid Uganda looks like in the next 5 years.
Thank you, Honorable Speaker. I think from the discussions and the conversations that we've had, the situation is very clear.
Indeed.
And actions need to be taken. Actions need to take place. Focusing in healthcare facilities, the need is big. We need WASH in communities. We need WASH within schools. That goes without any doubt, and no one can deny that. But as it stands, how do we prioritize and tackle stepwise for us to gain those achievements? And if we look within healthcare facilities, I believe that is possible if we can be able to plan together. Last year, the Ministry of Health launched guidelines for WASH in healthcare facilities that sets the standards that we need to be able to achieve within our healthcare settings. I think it is now taking those guidelines and being able to action it. Whether you are at the national level as members of parliament, whether you're at the district, we have these guidelines that sets out what a healthcare facility needs to have in terms of WASH. Now, if we have healthcare facilities that do not meet these standards, why are they open and providing services? These, I think, are the bylaws that we need to have. These are the actions we need to have from our decision makers in taking to make sure that any healthcare facility should be able to provide the service that it needs. The guidelines are there. Why is it not happening? Why are we not prioritizing to ensure water is 24 hours? We need to set a target for us in achieving this, and I think that action needs to be done like now. When we're looking at the gaps in resources, the blockages that we have within the system that facilitates WASH, we can't just point hands and fingers to the government. There are many players. We are part of the players. Communities are players. We've heard about behavior change. How are communities being sensitized in terms of understanding their awareness, in changing their behaviors, but also taking the ownership in addressing some of these challenges? I think this is quite key. We need a national campaign towards this, not only for healthcare facilities, but also for WASH in general, for us to achieve these targets. And this is delayed. We need to talk about it. We need to bring that to the forefront of everything that we are planning. We know resources are low, they're dwindling. Obviously, Parliament and government leaders need to be able to see how do they prioritize that and channel the right resources into this cause. So what action, how are we holding them to account? We need to hold these leaders to account. That is our moral duty, and we need to take action around that. But how do we also bring other players that have resources, the private sector, Rotary clubs, communities? How are we mobilizing these resources for us to achieve this? I think it is an area that we need to say, you know what, where we are, we shouldn't be. How are we prioritizing this? What target are we setting ourselves for the next 5 years? The way when COVID came and we mobilized resources to make sure that COVID does not take us down. So how are we setting the targets that come 2030, we are not going to have 85 with limited, but we're going to have 50% with advanced services. Those are the actions we need to put. Those are the targets we need to set at all levels. And that is what, as WaterAid, we want to work hand in hand in partnership. We are not pointing fingers. So to say, yes, we are pointing fingers, but what we need to do is to collaborate and to partner and know that we have a cause that we need to achieve. Let us achieve it as Ugandans we can, for God and my country. Thank you.
Jane Sembuche, Country Director, WaterAid Uganda, wrapping up this edition of the People's Parliament Lira edition. Of course, we were in Mbale before, and indeed so many people lauded or commended the good work WaterAid Uganda has done in that jurisdiction. Lira as well, indeed, is indebted to WaterAid Uganda and the good work you've been doing where government has actually been present. MP Jokino has actually called on to government to actually increase the budget for WASH facilities and services within Uganda at 8 billion Uganda shillings. He says that is little. And he also mentions that there is a slight increment of 600 million to make it 8.6 billion Uganda shillings. But he still says that is a really minute figure, and we need to increase and enhance the budget to actually ensure that we advance and improve the water, sanitation and hygiene sector at all levels, national, subnational, and also at the community levels. My name is Romeo Busiku. I've been more than humbled. Next stop will be Kabarole District, where we shall actually also assess the water, sanitation and hygiene sector within Kabarole District. For now, this session of the People's Parliament has come to an end. I'm your speaker, Romeo Busiku. All rise.